most people don't know. But most people think, wait, or there's pediatric sleep issues. Yes, actually. So anywhere from behavioral sleep issues, which are actually the most common. So if you have that child that's either scared of sleeping alone or does not want to sleep alone, or you have a baby that's maybe snoring, or a younger child that's snoring, or a toddler that fights bedtime, or you have an adolescent with insomnia because they have anxiety or some other issue. All those things are within that kind of pediatric category. And then we also have, we have sleep apnea, we have restless leg syndrome, we have circadian rhythm issues where you have like the extreme night owls and things like that. And then we also have conditions like narcolepsy. So those are all relatively common pediatric sleep problems, somewhat similar to adults as well.
I
Yeah.
had no idea children could have narcolepsy.
Yeah, 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 yeah. It's a thing. It's a thing. And it actually, what happens is because it's not diagnosed, because people just think they're lazy, they're depressed, they're
Oh,
sleepy. It ends up delaying diagnosis for as much as 10 to 15 years. So really, really big, big, big issue.
I had not thought of that. Um, so that blew me away. That narcolepsy. Okay, so I can understand there are children that do snore because I've had a friend that had her son had to have his something removed because of his snoring, and he was just having such issues. I don't know if it was his adenoids or something. Does this
Yes,
make sense?
probably adenoids. Yeah, adenoids, tonsils.
Okay.
Hmm.
So now you wouldn't do that surgery though. You would just recommend it.
Oh, yes, exactly. So for me, my role is you have any kind of sleep issue. Either you're having a difficulty falling asleep, or you're waking up with non-restored sleep, or you're having a hard time, with how you're sleeping. So that piece really then leads to a hard time with staying asleep. And so that's my role. My role is to be your investigator to say what is getting in your way of getting good sleep. And so based on that, we can then decide, do you need a sleep study? Do we need to put in for insomnia treatment? Do we need to refer you to a therapist or an ENT doctor if you need surgery? I mean, if you do a sleep study and it shows, for instance, you have sleep apnea, then I take care of that. So you're coming back
Right.
and managing the sleep apnea and things like that. But we have a lot of people, other disciplines that we work with. Do we have allergies that it's now really driving your snoring and things? We send them right to you, Dr. Renee. So we kind of co-manage that with a lot of other disciplines.